I am Dr. Padmakumar. I am the Director of Critical Care Medicine at Fortis Hospital. I just wanted to tell about a case which we was treated in the ICU. This is a young lady in her early 40s who was admitted in the ward and undergone a surgery. And from the post-operative period, she was mobilized in the ward and we got a call for a code blue. Our code blue team went and found that this lady was unresponsive. So immediately they started CPR, and after resuscitation, she was shifted to ICU. As soon as we knew that there is a patient post-operatively collapsed in the ward, we were all prepared in the ICU to receive this patient. And after the initial resuscitation, when she arrived in ICU, she had heart rate of around 150 and very feeble pulses. So immediately we started thinking about what are the possible causes of this patient being collapsed in the ward. The first thing always comes to our mind is some condition called pulmonary embolism, which is a common occurrence after any surgical procedure, because during the surgery our body will have high amount of thrombotic tendency. Basically any surgery will cut open your blood vessels, so our body will always try to stop the bleeding. That is the natural tendency of our body. So any patient who undergoes surgery, they always has got a very high risk of thrombotic complications. So this lady post-operative period suddenly collapsed in the ward. The first thing as an ICU doctor comes to my mind is always, is this a pulmonary embolism? So when this patient came down, we immediately placed our echo probe, which is a echocardiogram test. We generally try to assess what is happening in the heart. And we found that her cardiac chambers are dilated and her pulse was still very, very feeble. Within seconds, actually, she had another cardiac arrest, and we have to start the CPR process again. So it was relatively evident that this patient had a pulmonary embolism based on the history and what we found on the echo. The next question was that what we can do for this patient. Usually, when somebody collapses with a massive pulmonary embolism, it is almost like getting a heart attack. So there won't be any circulation which is going across the heart to the lungs. That is what happens in the pulmonary embolism. So until and unless you solve the problem, there is no way we can revive this patient. But the challenging part was that this is a post-operative patient. So usually for any patient like heart attack, generally we use something called thrombolytic drugs, which will try to dissolve the clot. But in a post-operative patient, using a thrombolytic agent is always a very high risk process, because the patient has undergone a major surgery and the patient will continue to bleed if we use thrombolytic agent. So that was the challenge in front of us. So we had to consult our cardiologist also, Dr. Rajpal Singh, and after his advice, we decided to go ahead with the thrombolytic therapy, since it is a question of life and death. And it was challenging to continue CPR non-stop for half an hour before we could procure the drugs to give the thrombolytic treatment. And I am glad that all our team members has actively participated in the resuscitation process till we procured the drug and completed the thrombolytics. And immediately post thrombolysis, we have got a remarkable improvement in the blood pressure and her blood pressure stabilized within another couple of hours. After her blood pressure started improving, the next challenge of the process was that because we have already given the thrombolytic therapy, her risk of bleeding is going to remain very high. So we had to be very careful watching and monitoring for any bleeding anywhere in her body, especially all the surgical sites. And we kept all the blood and blood products ready in case there is a bleeding. And initial phase after resuscitation of any kind after a cardiac arrest, which almost lasted more than 30 minutes, we were all worried about what is the aftermath of this event. Usually we are more worried about the brain because the brain is very, very sensitive to oxygen, and if there is no blood supply to the brain for even for 3-4 minutes, brain cells can damage. So basically that was the first worry we had, whether she is going to suffer any kind of hypoxic encephalopathy to the brain. The second issue was that we need to keep on monitoring for other organ dysfunction which can happen, because there was a stage where she did not have any circulation except the CPR we were giving. Fortunately, within couple of days she woke up appropriately, and she didn't have any kind of neurological deficit. Even though she had renal failure, she required dialysis to support her kidneys, which also progressively got better. She suffered some injury to the liver, which within a week's time started improving. It was a remarkable achievement for the entire team, as the CPR process was very efficient and we were able to maintain her cardiac output very efficiently during this half an hour when we were maintaining her with CPR. And other point I just wanted to highlight is that I came to know that this lady had COVID infection few months prior to this, because any infection, especially COVID, has got a high risk of developing thrombotic complications, especially up to 3 to 6 months time. So it may be incidental that she had a COVID infection, even though you didn't have a severe COVID. There are a lot of case reports of patients getting thrombotic complications, including heart attacks and strokes, and something we called as cerebral venous thrombosis, which are all reported in the literature for past 2 years. So anybody getting a COVID infection, you should be always remember that risk may remain with you for maybe close to a year. Second thing is that it was a post-operative patient, high risk for developing DVT, and patient might have a thromboembolism that is also known to happen. But at the end of it, we are all happy to send this lady home after full recovering from her devastating episode of pulmonary embolism.
Hello, I'm Dr. Manisha Singh, Senior Consultant Gynecologist and Subspecialist in Reproductive Medicine and Surgery at Fortis Hospital, Bannerghatta Road. Today, we are going to talk about a very interesting case that we did recently in Fortis. A young lady, 42 years of age, with no comorbidities whatsoever, presented to my clinic with a history of tiredness, a swelling in her tummy, heavy and painful periods. On further investigation, we ascertained that she had multiple fibroids in her uterus, making the size of her uterus the size of someone who must be about at least 5 to 6 months pregnant. So this lady needed a myomectomy procedure, which entails removal of all the fibroids from the uterus and restoring the normal uterine anatomy. On the routine workup, we found that she was anemic, in view of which She was transfused with 2 units of blood. Complete investigation profile showed that there was no abnormality whatsoever in her investigations, including her coagulation profile, which was completely normal. She was subsequently listed for the myomectomy procedure, which was completely uneventful. And we removed about 8 large fibroids. In the post-op period, she was absolutely fine, and within 24 hours, we mobilized her. Thromboprophylaxis had been initiated post-surgery. While she was mobilizing, on the first post-operative day, 30 hours post-surgery, the lady started feeling dizzy and she collapsed. Thankfully, because there were enough staff around her when she was mobilizing, a code blue was put out and the cardiac team, the MICU team, were alerted. It appeared that she had a cardiac arrest, and immediately the CPR, or the cardiopulmonary resuscitation process was initiated. After 15 rounds of CPR and thrombolysis, which means breaking down of the clot, we were able to stabilize the patient in the intensive care unit. Her care was taken over by the MICU team as well as the cardiac team. Following this acute shock, her kidneys also showed signs of decompensation, which necessitated dialysis for 72 hours. The patient made a wonderful recovery a week down the line and was discharged home on the 12th postoperative day. Now, what makes this case very interesting is the fact that this patient had a massive pulmonary embolism on day 1 post-surgery. The commonest cause of pulmonary embolism in a patient who is post-op is deep vein thrombosis. Now, did this lady have deep vein thrombosis? No. So she underwent a complete evaluation trying to ascertain where this blood clot had come from despite thromboprophylaxis being in place. We found that there was no evidence of clot anywhere except the clot that was there in her lungs that had caused her heart to stop. And that is termed as cardiac arrest, where the electrical activity of the heart stops. So what is the only thing that was abnormal about this patient? Interestingly, this patient had had the COVID infection during the 3rd Omicron wave, about 8 to 10 weeks before she underwent the surgery. She had already had 2 doses of the COVID vaccine in 2021. She had told us that her infection was mild and she did not need hospitalization during the same. So the only thing that we can conclude from this entire episode is that the blood clot in her lung, or the pulmonary embolus that she suffered from, is secondary to the COVID infection. We now know from multiple reports across the world that COVID infection predisposes individuals to increased risk of blood clots. The point we wish to make here is that anyone who has had a COVID infection must seek assistance from their respective physicians or clinicians to check if they need to be on a small dose of blood thinning agents or medications for up to 12 weeks post-COVID infection. This would substantially reduce your risk of blood clots and sudden cardiac events like this. Thankfully for this patient, it was a witnessed cardiac arrest with the code blue team standby Immediate CPR was initiated and thrombolysis was put in place. And that saved the day. So here's wishing the patient very well for all the future events in her life and wishing all of you good health, and make sure that you check with your doctors at regular intervals what are the effective measures you need to put in place, especially if you've had the COVID infection in the recent past. Thank you.
Hi, I'm Dr. Rajpal Singh, interventional cardiologist and director of cardiology at Fortis Hospital's Bannerghatta Road. I was involved with this lady's care as the cardiologist who looked after the management of her pulmonary embolism. Interesting to talk about this lady's management. She's a young lady who underwent surgery and had an episode of cardiac arrest, which turned out to be pulmonary embolism, which is clot in the lungs. This is an acute clot development. This is not unheard of in people who undergo surgery. In fact, that's the reason why we give them blood thinners immediately after surgery. But what also is important is this lady had recently recovered from a COVID illness, and the COVID illness per se is prothrombotic, i.e. increases the risk of clot formation. So that might also be a contributory factor. The treatment for these kind of acute decompensations or acute emergencies is to try and resuscitate them, which is done with very effective cardiopulmonary resuscitation. But what really makes the difference is thrombolysis, that is thinning the blood or breaking the clot that is blocking off the main arteries. This is a very important line of treatment. In this lady, this was quite risky as well, because she had recently, a day before, undergone a major surgery. So there would be a lot more raw bleeding points. But it was a very important decision for us to take, that we save her life rather than worry about just the bleeding complications, and that's how it was done. And it's delightful to see her walk out of the hospital. In fact, I've just seen her in my outpatients. She's doing quite well. She's going to be on blood thinners for a period of time, to about 6 months to a year, and any further surgeries will be taken with extra precautions, like giving her blood thinners well before the surgery also, and ensuring that she has blood thinners for a prolonged period of time.